I knew that I wanted to do public service, and I knew I wanted to live abroad and learn another language. So really hit the mark across all of those areas. And it was the most amazing experience. I highly recommend anyone who's interested in either finding a career or understanding different cultures and languages. It's a great opportunity to not only learn what you want to do, but learn more about yourself.
I absolutely believe that. I had a couple of friends from undergrad that went into the Peace Corps and then discovered like what they really wanted to do in the world. So that's awesome. And I definitely support that for other people that are interested in like getting experience and like real hands-on experience in real world settings. It's a rewarding time, and I feel like especially if you're doing it early in your career, it just opens up your mind to so many different opportunities.
So true. I made $11 a day and I had plenty. So it was great. And particularly I lived on a remote outer island and had a family that hosted me, and they became really part of my family and taught me so much. So I really value that experience and how it brought me into global public health.
And then continuing to get your Masters of Public Health, what are some experiences or skills or things that you took away from that you still apply to the work that you do today?
I am so grateful for the opportunities that I had when I went to Columbia. I had a graduate research assistantship, and I worked on a study that looked at the social and medical services that were provided to people with HIV. So I was getting the foundational work or education, taking classes, but then I got to apply them through this research assistantship that I had at Columbia, and it was a great experience. Not to mention studying public health in New York City. It's just a great opportunity to take advantage of all that New York City has to offer as well.
And then you alluded to a little part of this. Before you joined Bloomberg Philanthropies, you worked at the National Hemophilia Foundation and the New York City Department of Health and Mental Hygiene. What were some pivotal lessons from these roles, and how did they prepare you to lead large-scale public health initiatives?
I feel very fortunate that I had the opportunity to work on a domestic program. So at the National Hemophilia Foundation, we were really supporting education to people with bleeding disorders, but we worked with local organizations across all 50 states. And so really just recognizing, and I think I recognized this very early on in the Peace Corps, is just, there's so much expertise out there. You really need to tap into kind of the local practitioners, the local leaders to guide the work. And so having that opportunity at the National Hemophilia Foundation to work with chapters across the country on how to better inform people with bleeding disorders and on how they can really prevent further issues, that was a great opportunity. And then the New York City Health Department was just a phenomenal time. Mike was mayor at the time. He prioritized public health as mayor and continues to do that through the foundation. And I really felt like the health department was my public health boot camp, and learned so much from so many people that are so committed to public health and really doing public service through the health department.
Love that. I love that. And what does public health mean to you?
It's so interesting because it's changed over time. We look at the data, we look at life expectancy. I think that public health means living a fulfilling, healthy life, and there are many ways to do that through stronger policies, through better behaviors. And so there's just a combination of so much that goes into improving public health. It's not just one thing. And so really being able to utilize expertise across the foundation, across our international partners, across governments and local organizations, it's tapping into that expertise to strengthening public health.
How do you believe that public health relates to global health from your perspective?
Well, I mean, we know, like when you think about, public health issues, most global health, low and middle income countries bear the burden. And so, really it's our role to provide resources and support to those countries that have the greatest burden across so many different public health issues. And public health, varies so broadly. You've got communicable diseases, you've got non-communicable diseases, you've got injuries, and how do you attack those issues across different countries? And it's challenging, but there are so many great opportunities as well.
Absolutely. And I think about that a lot because I'm originally from Trinidad and Tobago, and thinking about like climate disasters and who pays for the reconstruction after climate disasters, and just how fragile some of these systems are in countries. And you really do think about the bigger scheme of like, we are all in this together. I think the pandemic has showed us that. So how do we support all countries when most of the time the Western world is creating the burden that many of the other countries are dealing with?
I think also, putting some of these issues on the map and utilizing data and helping leaders understand the burden of some of these public health issues. At Bloomberg Philanthropies, we support non-communicable diseases and injuries. So we're working across many programs to reduce the burden of non-communicable diseases, NCDs, and injuries, because we know that 8 out of 10 deaths globally are from those issues. And so what can we do to really ensure that people can live better, longer lives? And we're doing that through our public health programming here at Bloomberg Philanthropies.
Yeah, and let's talk about that a little bit more. So, talking about some of the work that y'all are doing, y'all have the Partnership for Healthy Cities and Global Public Health.
Mm-hmm.
Can you just tell us what the Partnership for Healthy Cities is, what's its mission, and why it's important for urban health and public health?
In 2017, Michael Bloomberg was named the WHO Global Ambassador for Non-Communicable Diseases and Injuries. And that goes back to the data that, 8 out of 10 deaths globally are from NCDs and injuries. And so WHO wanted to, support Mike to be an ambassador to help increase awareness of the burden of NCDs and injuries. So when he was named Global Ambassador in 2017, we wanted to back that with a program that would support NCD and injury prevention. And so we started the Partnership for Healthy Cities, which is really a prestigious global network of cities from around the world, in every region of the world, high income, middle income, and low income cities that all are committed to reducing NCDs and injuries. And so we have 74 cities that are a part of this network. And through our funded partners, the World Health Organization and Vital Strategies, we are providing support to those cities to work on specific NCD and injury issues where we know what works to reduce deaths and the burden. And so it's been almost a decade, not quite, but it's been just invigorating to see how cities are really working to tackle these issues and working together and learning from each other to really improve the health of their citizens.
And with over half the world's population